Hi, everybody. My name is Nikki. I'm the adult librarian at the Forest Avenue Library. Thank you for coming out on a very hot night to talk about something we all wish we didn't have to learn about. I really appreciate Nola Agner-Davis from the Polk County Health Department also putting this together for us. The live transcriptions are on if you need or want captions. And as the machine just told us, we are recording. So if you have friends who can't make it, you should be able to get them a recording of it later. If you have questions, you can either send them to me in the chat or hold them for the end. But if you think you're going to forget them, put them in the chat. And I think that's really all the business. I'm going to give it over to Nola.
Good evening, everyone. I am Nola Agner-Davis, and I am the Public Health Communications Officer for Monkeypox. I'm the Public Health Communications Officer for Polk County Health Department. Today, we're going to give you an overview of monkeypox. So first, let's talk a little bit about how we look at monkeypox. So the CDC is working in partnership with Iowa Department of Public Health and Human Services, along with Polk County Health Department, to really track monkeypox across the United States and across the world. We don't normally track monkeypox because this is not a virus that we see a lot of activity of. But right now we are seeing an outbreak. So this is when the CDC will really work with state and local health departments and partners such as the World Health Organization to really start tracking monkeypox and really sharing a lot of prevention methods. So let's talk a little bit about monkeypox. So we can see that there are cases in all but 3 states in the United States. As of July 27th, Iowa has seen 9 cases, and 6 of those cases would be in the central Iowa area. You can visit Iowa Department of Public Health's website. We also have a link on our website at polkcountyiowa.gov/health department that shares kind of how the state of Iowa is looking at that, as well as how the CDC is looking at that. So we can see that there are cases in a majority of the United States. This also kind of gives you a little idea of what we are seeing throughout the world. As of yesterday, we have monkeypox in the world at 79 locations. There are 72 countries that have not historically reported monkeypox. And then we have 7 that have historically reported monkeypox. You can see the ones that historically reported monkeypox are in our Central and West Africa areas, and that is where we know monkeypox has originated. So this kind of gives you a good overall depiction of what we're seeing in the world, the United States, and in Iowa. So let's talk a little bit about monkeypox. So monkeypox is a rare disease. That's a virus that's caused by infection with the monkeypox virus. Monkeypox virus is part of the same viruses as the variola virus, and that's the same kind of family that causes monkeypox. Monkeypox symptoms are very similar to smallpox symptoms, but milder. Monkeypox is rarely fatal. This is not a type of pox that is related to chickenpox. So they are similar to smallpox. This virus was discovered in 1958. We saw 2 outbreaks, pox-like outbreaks of the disease that occurred in colonies where monkeys were kept for research. So that is, despite the name monkeypox, the source of this disease remains unknown. However, we know that it could be something as African rodents or non-human primates, such as monkeys, might harbor the virus and infect people. So that is maybe one of the things that we're seeing of how monkeypox started. The first human case of monkeypox was recorded in 1970, prior to the outbreak that we saw this year. Monkeypox has only been reported in people in several central and western countries. So as you saw when we looked back at that map, that is where those blue dots originated. That would be West and Central Africa. Previously, almost all smallpox cases, if they were in people outside of Africa, were linked to international travel. So when we see cases that popped up outside of Africa, those were due to international travel, where the disease commonly occurs or through imported animals. These cases occurred on multiple continents. So how does monkeypox spread? So there's a couple of ways of how monkeypox spread. This is a really great graphic that kind of depicts on how it spreads. It can be spread through close contact, including sexual contact with someone who has the virus. So we can see it spread through bodily fluids, a monkeypox rash or sores or scabs, respiratory excretions, saliva, eyes, nose, and mouth, contaminated objects or shared personal items such as bedding or towels, and pregnant people can pass the virus to their fetus through the placenta. So let's break this down a little bit more because this doesn't provide enough description. So monkeypox can spread to anyone through close personal contact, often skin-to-skin contact. And so what I mean by that is someone has direct contact with the monkeypox rash, scabs, or body fluid from a person who has monkeypox. I have to touch an object such as clothing, fabric, clothing, bedding, or towels and surfaces that have been touched by someone who has monkeypox. Or I have to contact through respiratory secretions. And that we mean by that is it's close personal secretions respiratory. It doesn't mean that someone coughed, talked, or sneezed on you. It has to be in very close, intimate contact. This direct contact can happen during intimate contact, as I said. Any type of sex, whether it's oral, anal, or vaginal, or touching the genitals, penis, testicles, labia, or vagina, anus of a person who has monkeypox. Hugging, massage, or kissing, and prolonged face-to-face contact. Again, it has to be prolonged face-to-face contact to get those respiratory secretions. Touching fabrics and objects during sex that were used by a person with monkeypox that has not been disinfected. And this is where it comes with bedding, towels, or sex toys, or fetish gear. A pregnant person can spread the virus to their fetus through the placenta. It's also possible for people to get monkeypox from an infected animal, either by being scratched or bitten by the animal, or preparing or eating meats or using products from an affected animal. So right now in the United States, that is not something that we have to worry about. That is more for people who are living where those animals, such as rodents or monkeys, may live. So again, that's where we see the West Africa and Central Africa come into play. I think it's very important for people to realize that if a person has a rash or has like the scabs, the sores, the fluid, it can spread to a person from the time the symptoms start, the time that rash starts, till the time that rash is fully healed and a new layer of skin has formed. That can take from 2 to 4 weeks. So if you don't think your sores are not exposed, well, you can touch those sores and have that fluid on your hands, and we can still see someone getting it transmitted that way. Still, there's a lot of science being done, still looking if the virus can be spread with someone who has no symptoms. How often monkeypox is spread through respiratory secretions, or if when a person with monkeypox symptoms might be more likely to spread the virus through respiratory secretions, or whether monkeypox can be spread through semen, vaginal fluid, urine, or feces. So these are things that are still being researched by our individuals in public health. Let's talk a little bit about some of the symptoms. So some of the symptoms may include a fever, a backache, swollen lymph nodes, a headache, muscle aches, chills, or exhaustion. The most important thing too is the rash. So I think what we also have to realize is that rashes are going to look different over time. So it may start out like pimples or blisters and then may change over time. So people's rashes may look different at different stages of the virus. This rash usually appears on the face, the inside of the mouth, on parts of the hands, feet, chest, genitals, or anus. Monkeypox symptoms may start 5 to 21 days after you're exposed. This time between when you're exposed and when you have symptoms is called the incubation period. So this is when you're starting to incubate, and this is when you're probably the most infectious. About 1 to 4 days, after you have a fever, this is when we will see a rash. Again, that rash often appears on your hands, your face, your feet, and then spreads to other parts of your body. The rash, again, like I said, goes through many stages. So it's going to look different from person to person, especially as they're going through different stages. The flat bumps may turn into blisters, and the blisters fill with pus, scab over, and fall off for a period of 2 to 4 weeks. Remember, you are still infectious until that new layer of skin grows over. So you have to have that scab fall off, and then that new layer of skin grows on it, and you are not infectious. Again, you can spread monkeypox while you have symptoms. So from when your symptoms start until your rash and scabs heal. So again, if people think, well, my rash is not exposed, that doesn't mean you still can't spread it. Individuals may experience symptoms different. So you may have all of the symptoms that we talked about, or you may only have a few. Some people may get a rash first, followed by other symptoms. Some people may only get a rash. What we normally see is most people will get a rash. Some people may have developed a rash before or without symptoms. So again, it's really important that you know symptoms are different. Every virus is different. How it affects a person is very different. So symptoms may vary person to person because we all have different immune systems. So how do we prevent monkeypox? Okay, it's a great thing to think about. So I think the most important thing is if you know someone who has monkeypox, if you know someone who has a rash may have monkeypox, that looks like monkeypox, avoid close skin-to-skin contact with that person until the rash is completely gone. Again, skin's got to develop over that scab. Do not touch the rash, the scabs of a person with monkeypox. Do not hug, kiss, cuddle, or have sex with someone who has monkeypox. A big thing too is avoid contact with objects or materials that a person may have used that has monkeypox. So do not share eating utensils, cups with a person who has monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer, especially before eating or touching your face and after you use the restroom. And I think that's important for everything. You know, we are still seeing high cases of COVID-19 in Polk County and in the Iowa and in the nation. So again, thinking about using soap and water, or if you don't have soap or water, an alcohol-based hand sanitizer often, because again, that is your best line of defense to help cut down any spread of any germs. Cover your coughs and sneezes, again, very important for COVID as well. The most important thing too is anyone can get monkeypox. So anyone can pass monkeypox if they come in close contact with someone who has the virus, regardless of sex, gender, sexual orientation, and race. One of the best things that we can really do to avoid your risk and to reduce the risk of monkeypox is to reduce the number of sexual partners. This will help to reduce your overall risk of being exposed to someone with monkeypox. And when we are starting to see the emergence of monkeypox in the United States, this serves as a great reminder to stay up to date on your STI testing based on your sexual behavior, your partners, and if you have symptoms. Right now in Polk County and in Iowa, the vaccine is only available for those who have direct close contact with someone who is confirmed positive for monkeypox or who cares for an individual with monkeypox. So we are not giving the vaccine right now post-prophylaxis, which means as a prevention tool. This is only for individuals who may be confirmed close direct contact to someone who's positive for monkeypox, or someone who is caring for an individual who is positive for monkeypox. If you think that you may possibly have monkeypox, you would call your healthcare provider if you've traveled to an area with high monkeypox cases. If you have symptoms of monkeypox, particularly the characteristic rash or lesions, or you've had contact with a confirmed or suspected monkeypox case. So with that, I will stop sharing my screen and I will answer any questions that we have.
So there's one question in the chat from Andrew, which is, how long does it take from infection to symptoms becoming visible?
So we see about probably 1 to 5 days, okay? 1 to 5, typically in that range. So you may not have any symptoms and then you may develop that rash, or you may have other symptoms. And again, symptoms may occur before you develop a rash.
Anyone else, if you have questions, you should be able to unmute your mics, or you can put them in the chat.
I think it's important for our community to know that this is not an easy virus to get. So it's not like COVID. You know, when I cough, talk, or sneeze, those droplets are going to land in the eyes, nose, or mouth of someone. So with monkeypox, you have to have close, intimate contact with an individual who is confirmed with monkeypox. I think that's the most important thing. Also, the most important bit of advice is there are great prevention methods. We have them listed in this presentation as well. You can visit our website, polkcountyiowa.gov/health department. We have a page that is information about monkeypox. We have links to our website, CDC's website, and Iowa Department of Health and Human Services website to get additional information. If there are questions that people have after this, you can email our health department account. We have a general account, and you can email us those questions, or you can ask us on social media. We have Facebook, Instagram, Twitter, and TikTok, and we are happy to answer any of those questions that you have.
All right, I don't see anybody unmuting, and I don't yet see anything in the chat. So I'm going to commence the wrap up. And if anybody does unmute or add anything to the chat, we will pause and go to that. But I just wanted to let you all know about a few other DMPL programs that are coming up. So tomorrow we have a sign up for Password Managers event that's also virtual. Password managers are software that will remember all of your passwords for you, which is great because it can like help you. It makes it a lot easier to have unique passwords for every site, which is way, way safer online. If you get hacked in one place, you don't get hacked everywhere. And it's also so much more convenient because you don't have to remember anything. I'm a big password manager evangelist. I love them. We also have some cool things coming out in person all around DMPLs. So we have several Ending the Silence programs with the National Alliance for Mental Illness. At the Forest Avenue Library on the 10th, we have Ending the Silence for Families, and at the Southside Library on the 17th, we have Ending the Silence for Adults. Those will both be at 6:30 p.m. And then I'm also, that's the only like very soon health related thing that we have coming up, but I also want to mention that the State Fair trivia this week at the East Side Library. If you go, you can win State Fair tickets, so you might want to know about that. All right, thanks Nola, thanks everybody for coming, and I think we're gonna close it up, but I will I'll send out the link to the to the recording once I get it to everyone who registered for this program. So if you want to share with your friends, you can.
Thank you.